Hello, everybody. This is Professor Klein. On behalf of the STEM division, our STEM advisor, and my colleague, another faculty advisor, Mr. Asana, we want to welcome you to Advising Week and provide some resources for you. I've been tasked with helping you learn about the process for becoming a healthcare provider. Regardless of what field you're interested in, processes can be pretty similar, and the expectations and requirements for being a strong candidate are also fairly similar. So whether you want to be a radiographer, a nurse, a podiatrist, or any of the 100 other careers in healthcare in this modern world, take a moment to kind of absorb what we want to share with you and be ready to work with your advisor to be a successful candidate. So what does it take? These careers are noble and fantastic and rewarding. They're also some of the hardest things that people will ever do. They're pretty competitive. All these healthcare provider programs that train you to be that phenomenal professional, it takes a lot to get in. And it's about more than just grades, although grades are part of that. So we'll come back to the application process. Believe it or not, some of these jobs aren't the highest paying, especially if you think about providers that have to purchase malpractice insurance or pay for staff. It's not the best lifestyle. It's a hard lifestyle. Some healthcare providers, their schedule might be shift or graveyard. They may rarely cross paths with their family. Even if they may have more of a 9-to-5 job, chances are that patient's going to need them in the middle of the night. It's a selfish career, not because the healthcare provider is selfish, but because they have to sacrifice so much of themselves in their life to their patients that sometimes their families suffer. These are lifelong careers. Medicine, patient care, science is ever changing. And so these providers have to constantly stay on top of their field. And it requires continuous sacrifice because of the time commitment, the professional development commitment, and the emotional commitment of helping people when they might be at their worst in their life. So these are things we want you to think about. Are you ready for these challenges? So if you decide that's it, I'm ready, I have been called to do this, that's great. We're here to help you and get you to your endpoint. We want you to know ahead of time, though, that to be a competitive applicant, regardless of what career you're going after, requires two things. You need to prove that you can do academic work. You also need to show that you're a good human being. That's a quote from an admissions dean at a med school I once met. So again, always keep in mind, you have to prove that you can do the academic work, and you have to show that you're a good human being. So let's talk about how to address these two parts of being a strong applicant. So here's the big four. These are just 4 careers out of a good 120 careers in healthcare. So while I'm focusing on the big 4 here, realize that every program you're interested in has its own set of requirements, prerequisites, entrance exams, and application processes. So even though you might not want to go into these 4, chances are the one you want to go into still requires you to come to the table with something. So let's go through the big 4 pretty quick. Medicine, there's 4 kinds of doctor. All kinds of doctor require some kind of completion of an undergraduate degree, like a bachelor's of science or bachelor's of arts. That's to show that you can do academic work and that you can finish what you start. In the world of doctors and medicine, there is an application exam called the MCAT, and scores on the MCAT can be a significant part of an applicant's evaluation. So completing an undergraduate degree and doing well extremely well on that MCAT show you can do academic work. But the other half of that application processes are your life experiences. You need to tell the story of your life. Why are you driven to go into medicine? What experiences have you had in your life that will have set you up to be a great healthcare provider? Why are you driven to do this? So those experiences speak to that second part. Are you a good human being? In pharmacy, we see the same thing. Completion of prerequisite courses. Some pharmacy programs might also require an undergraduate degree. Do your research. Pharmacy schools also have an application exam called the PCAT. So prerequisites, potentially having an undergrad degree, PCAT scores speak to your ability to be excellent at academic work. But you also see those experiences. They speak to, are you a good human being? So if we look at dentistry, same concept, completing an undergraduate degree and a DAT as an application exam, speaking to your academic performances, and then experiences, speaking to you as a human being. Even physician assistant, undergraduate degree is required. The application exam for that is generally the GRE, and you need a lot of experiences. Some of these programs might require volunteer time. Some of these might require laboratory time. Some might require one economics class versus the other economics class. Some might not require the application exam, but something else instead. In the case of physician assistant, they require a lot of clinical hours of experience. So you need to do your homework. Once you have figured out what you are called to do your homework on those programs and what their specific requirements are. There are so many applications and applicants for these different programs that they're not very forgiving. I'm going to give you a couple of numbers. In medicine, for med school, your average med school might have 100 to 120 available slots. But those med schools may receive anywhere from 3,500 applications on the low end to 10,000 applications on the high end. Every one of those 10,000 people is competing for those 100 slots. So because of that, all of these programs aren't forgiving. They will not extend deadlines. They will not make exceptions. They don't have to. They have gigantic applicant pools that they're going to have to weed through. PA, physician assistant, is very, very picky with your hours. Some of these programs will have specific hours, and it's not volunteer hours, it's clinical experience, and they will make no exceptions to that. GPA for some physician assistant programs too could even be higher than some medical schools. Pharmacy. Pharmacy wants to see lots of experience, lots of chemistry, lots of economic background. Dentistry, believe it or not, in dentistry, they want top-notch students too, but they also want you to have an artistic side to you. So again, once you've chosen whichever field, whichever of these 120 fields you are interested in, do your research as to what the application process is going to be and what the applicant pool, what it looks like, and what the people evaluating your application are looking for. Okay, so competitive applicants. You need to have strong GPA, right? The reason there are prerequisite courses is the content in the prerequisite course is required for the pathophysiology and the clinical courses you will take in their program. So they want to know you can do academic work. It's not, students sometimes focus on an A, and I understand, but you also have to focus on the learning. You have to earn that A. It's not about getting to the nursing program. It's about being successful at the end of the nursing program. Some programs also require the applications test. Again, that could be a TEAS test for allied health or nursing. It could be a GRE, an MCAT, a DAT. It is up to you to find out if there is one and what it is. Sometimes there's fees associated with this. Some of those fees can be kind of pricey. The MCAT is not an inexpensive exam. TEAS test only runs on the Largo campus at very specific times. So it's up to you to research, is an application test required? And if so, when will it be available? So GPA, application test, these speak to, can you do academic work? Some programs may interview their applicants, and so if you have top GPA that's consistent, top application test scores, you might get an interview. It's not a guarantee. So again, these things speak to, can you do academic work? You also need to have your story told, your distance traveled. Where have you come from? What challenges have you been through? What lessons did you learn that let you know you are driven to do this? Okay. That is going to be reflected in a personal statement if you are required to write one. That will also be reflected in any letters of recommendation you might have to obtain. Not every program relies on those, but for the programs that do, do not underestimate strong letters of recommendations from faculty or people you worked with that got to know you. It's not good enough to have the A. Most of your professors, if you just get an A in their class, but they never got to know you outside of class, they're probably unwilling to write a letter for you. Because again, what's it take to be competitive? Strong academic skills, good human being. And the admissions committees are looking for evidence of both. So again, don't be afraid to write a strong personal statement. Work over your personal statement over years. Talk to faculty, go to the writing center, have them give you input on your personal statement. Your personal statement is your distance traveled, it's your story to tell, and you want to tell a strong story. If you are applying to a program that requires an interview, again, not all do, depends on the career path. You want to practice. If you have to go to a career, make sure you're dressed in business attire. You don't have to dress fancy. You don't have to dress expensive. You just want to dress in the best that you have to show that you care about this interview process. You want to practice doing interviews with other people if you can. Avoid distracting things. There's a lot that goes into an interview. Think of that interview as a job interview. And again, not every program or career path has an interview component, so do your research. And lastly, for those programs that ask for letters of recommendation, you want outstanding ones. What does it mean for an outstanding letter of recommendation? Well, it means that the person writing the letter can vouch for your academic performance, but they can also vouch for your personality. Are you a hard worker? Do the other students in the class get along with you? Are you helpful, respectful, gracious, and compassionate to the classmates that you worked with? Did you follow directions? Okay. Did you provide directions for other people? Did you take on a leadership role in the class? Have you had some challenges in the semester, but you talked to the professor in office hours, they made some suggestions, you put those suggestions into place, and maybe you went from a D on an exam to a 94 on the next exam? Those are all things that you want to have discussed in a strong letter of recommendation. Mr. Assanah and I are going to tell you, if you have a letter of recommendation that simply says, Jane Doe Bob Smith was in my class and earned an A, that's not going to help. That A is evidenced on a transcript, and the application committee doesn't really care that you got an A. They saw that on your transcript. They want to know, are you a good human being? So you want to form relationships with people that are continuous. You know, me, Professor Klein, I've had students that I got to know a few years ago, and they still once or twice a year send me an email to tell me how they're doing. And I love that. So those are some ideas for how to get strong letters of recommendation. It's about relationships over time. Okay, let's say somebody had strong test scores, their TEAS test for the nursing or an allied health program was awesome, they still didn't get in. Okay, well, sometimes those grades weren't as great as people thought they were. Okay, we understand, again, that students get focused on the A, but it's about the learning and the earning of the A that is the important thing. Someone could not be super awesome and maybe cheat their way to an A, then they go and sit for the TEAS test and tank and fail it. Even though TEAS doesn't have a pass fail, it's got a ranking system. So realize the prerequisites are there to help you build your skills. Okay. Look and speak to admissions representatives of the programs you're interested in. If you're interested in our allied health programs, we have a lot of them. They're awesome. If you're interested in our health program, there are specialized advisors you can talk to, and they'll be honest with you about GPA today, where it needs to be, what you're going to need to do to get there. Sometimes, especially in those programs that are going to require a letter of recommendation, sometimes the activities somebody engaged in weren't that meaningful. Okay, so I'm going to take physician assistant and clinical hours. Physician assistant schools, some of them used to take volunteer hours, but a lot of institutions now don't value volunteer hours as much as we think they should, because with medical laws and ethics and privacy rules, if you volunteer or shadow, you're not doing anything to help the patient. You just showed up and stood at the back of the room and watched. And that's valuable for finding out if this is the career for you, but that's not an experience you necessarily want to present as, am I a good human being? So activities that line up. Let's say you want to become a nurse practitioner. Have you ever thought of going to continuing education and getting a nurse assistant certification and the training and working for a few years as a CNA or GNA? If not, you should. It's excellent actual clinical training and experience. So you can do something meaningful, work your way toward your goal, and earn a paycheck at the same time. So if everything else were created equal and we were looking at a BSN program at University of Maryland, it's very expensive, or Johns Hopkins clinical nurse leader, very, very top-notch institutions and very competitive. Right? And so let's say Johns Hopkins clinical nurse leader is looking at one applicant who has excellent grades, excellent letters of recommendation, pretty good experience, like they were a nurse assistant in a geriatric home and they loved it, and their supervisor wrote a letter about how wonderful they are with patients, versus an applicant that's got excellent grades and maybe excellent admission scores, but no one who can speak to how that person interacts with the people around them, especially the people who are at risk or having a bad day. Who would you want in your clinical nurse leader program? Would you want the person who can absolutely do the academic work and has worked as maybe a geriatric nurse assistant for 3 years and the people they work with love them? Or would you want the person who has no experience? Who would you take a risk on? Chances are you're going to take a risk on the person that's got the 3 years experience. So think about entry-level careers that are suited to your ultimate goal. People who would like to go into medicine, well, EMT, paramedic is a great entry-level clinical, trained professional way to get experience. Medical scribe is some self-guided training, and there's a test you have to take. But medical scribe is a very entry-level position, but something to think about. Again, nurse assistant, phlebotomist. If you're interested in pharmacy, consider becoming a pharmacy assistant first. Okay. There are quite a few entry-level careers where, again, you can earn a paycheck as you're getting some clinical experience and building your portfolio so that you're an excellent applicant. So think about how the activities in your life speak to what you want to do. The other is choice of schools. This is especially true for pharmacy or medical schools and PA schools, and some nursing schools. There are some schools that have a mission and a vision statement. So a mission and a vision statement. And in that mission or that vision statement, they will say, we are looking for students who want to serve inner city underserved patients. And so those are the students they're looking for. So the student who's spent 3 years as a geriatric nurse assistant working in an inner city, maybe they were in the, working in a certain a ward in Washington, D.C., and they saw their elderly patients, but they also had a lot of patients maybe that were low income, and they loved it, and they felt fulfilled by that. They would want to apply to the program that's looking for people who want to serve in inner cities. Some programs want people who are willing to serve in the military. So again, do your research. If you're interested in University of Maryland School of Nursing, um, a clinical nurse leader, read the vision and mission statement of that program and see if you line up. Even if you have the best grades and the best letters of recommendation, if your story that you tell is the opposite of what they're looking for, you still may not get in. And here are some other things to think about, especially for medicine and dentistry. It is not fair. It breaks my heart. It upsets me because I came from a community college and I am so proud of my community college background. I think it's a blessing that the world decided to put me at a community college for my career. We are amazing institutions. We provide first chance, second chance. We do amazing things for our students. But it's not fair. But not all professional schools will accept the prerequisite courses that you have completed at a community college. I'm happy to say that's starting to change, but you need to do your research. My problem is the institutions that aren't honest about it. They'll be happy to take your several $100 application fee and then throw your application away and never tell you. So I want you to respectfully, kindly, politely, and professionally call every admissions program you're interested in your chosen career. Sweetly, kindly, respectfully tell them, because of my life situation, I did my prerequisites at a community college. I had great professors. They pushed me so hard. I learned so much. But tell me, will you be willing to entertain my application if I apply to you? I understand if you won't, but I need to know now because my time and my funds are limited. That's all you have to say. Let's make them start to tell you the truth instead of you trying to figure it out. But be polite, be respectful, and be gracious. Then come and tell me about how it went. All right. So again, how can you prove that you can do academic work? How can you show that you are a good human being? You are the best applicant for this radiography, nuclear medicine. I'm naming some programs at our institution. Surgical technology. You are the best person for this job. How dare this program not take you? Well, here you go. Consider building a portfolio. Doesn't even have to be official. Just think of these things. Do you have healthcare related experience? If you don't, talk to an advisor on campus. Consider continuing education and workforce development. Consider getting certifications through them and starting your career in an entry level workforce. Do you have any leadership skills or experiences? Consider being, an officer of a club. Do you have academic achievement? Look at those grades and have an honest talk with yourself. If they've been low, today's the day to figure out how you learn, how to manage your time, how to change your study habits so that you can improve them. There's lots of resources. Just talk to your advisor. Do you have any research experience? If not, you might need to get some, okay? There are a couple of folks on campus that you could be put in touch with if you're interested in research background or need it. What are your personal characteristics, right? Do you love working with the elderly people? Do you love maybe not elderly, but you love working with children? Build a series of experiences that speak to that. If you love working with kids, then as soon as you're able, maybe sign up with your local library or public school and volunteer with children. All right, if you're interested in something clinical, ask around. If you know somebody who's a radiographer, maybe they'll allow you an opportunity to shadow. If you have to get your 4-year degree, when you transfer and leave us, there are pre-health offices at the 4-year institutions that already have shadowing opportunities worked out that you can take advantage of. Are you engaged in community service? If not, think about it. Choose something that aligns with your career path. Once had a student who wanted to be a dentist. So I'm going to write dentist. She was a dental assistant. She was also a wedding photographer. And once a month for 10 years straight, she volunteered her time to provide free dental cleanings for a organization that worked with the homeless and homeless shelters. She did it because she loved it. Then the day came to apply to dental school, and she got to talk about how for 10 years she's been going to this once a month. She's been going to this clinic and volunteering her time, and how she told in her, because I was her advisor, in her letter, in her personal statement, she talked about how wonderful it was to see people smile, some of them for the first time ever. Can you see how powerful a message that is? So consider building a portfolio of the things that reflect who you are. So again, other things to think about, a personal statement, if required, you want to start working on it, you want to be honest, you want to be engaging, find your advisor, work with your advisor, utilize the writing center, come see Mr. Assanah or me, Miss Klein, and we can give you feedback as well. Start forming relationships with staff and faculty and coworkers, so when the day comes, they can write true, honest, and strong letters of recommendation. Look for and engage in volunteer service that mirrors your life mission. Again, if you love working with kids and you want to be a pediatrician one day, great. Sign up at your local library and your public school and become a volunteer, right? And other experiences, especially for work experiences, think about entry-level work fields that align with a career path and will kind of get you started. Okay, so a little bit more about personal statements. You need to tell your life story here. And again, Professor Asana and I actually offer some workshops through the Pre-Professionals Club on how to write strong personal statements. Look for that in coming semesters. Start early, be honest, be willing to be open and a little bit vulnerable with it. Work on it over time, use resources. This is where you tell your story. The one thing we don't ever want you to say is that you want to help people. I want to be a nurse because I want to help people. Guess what? Everybody wants to help people. I want to help people. I'm trying to help you right now. The admissions committee see past this line. They hate this line. Do not use this line. For all that is good in the world, please do not write that in your statement. Your statement needs to be your story, and it is evidenced through your story that you are driven to help the world. Okay. Letters of recommendation bear more value on an applicant's package than most people think. Again, this is about relationships. For me to write a strong letter, I'll be honest with you, I only write letters if I can write strong ones. I deny them all the time. So we need to know who you are. I need to know what kind of person you are inside the class, but also outside. I need to know what drives you to do this. I need to be excited to write the letter. I want to be able to go, oh my gosh, I cannot wait to do this. So get to know your professors, get to form relationships with us. Again, volunteer service. Match your mission to your passion. Make it ongoing. That former student who's a dentist now, that former student who's a dentist now performed free dental cleanings for 10 years. Now, again, experience, research experience, if it's required, shadowing, you followed a cardiologist for a couple of days and fell in love with what they do, or decided you hated it and you wanted to be a nurse instead. Work experience, again, think about those entry-level jobs that can get you into the real world. And if you fail, keep going. There's always a second chance. The key when we fail at something is to learn why we failed and to come up with a plan for being successful the next time. Never give up, but don't continue to do the same things. If something in this plan or this portfolio fails, do a self-assessment and figure out how to move forward in a way that will yield better results. Who can help you with this? Your advisors. That's what we're all here for. All right, so great advice for pre-health students. It's going to go by fast. Maybe take a picture at the end. Choose your school wisely. Remember, all programs are looking for students whose mission meets their mission. When it comes to like Prince George's Community College's nursing program, that's not necessarily evidenced in their application process. That's only because of the way the application process works. But choose schools wisely. Choose ones that are affordable. Choose ones that are nearby. Choose ones that have good reputation. Choose ones that whose mission statement matches your life passion. If you are interested in medicine, consider taking biochemistry. Biochemistry is on the MCAT exam. It is not a prerequisite as of fall of 2020. So consider taking it. Never give up. If you fail, we all fail. The trick is, how do you learn from the experience? How do you pull yourself up from that sadness? How do you move forward in a way to where you succeed the next time? When we fail, it means we've done, we've participated in something, we've done something, and we need to change what we did. Don't go after your goal the same exact way if you fail. Something needs to be switched up, and advisors are here to help you figure that out and to support you as you make those changes. Relationships are important. You're going to need strong letters of recommendation, so you need strong relationships in which to build them. Embrace your distance traveled. Embrace it. What we from community colleges have are we've got these amazing stories and these amazing backgrounds. I am a first generation college student in my entire ethnic community. I am I am several things. I'm mostly Cape Verdean from the Central Valley of California. I was the second person in an entire community of people to go to college. I was the first person to graduate. I'm not smart. I worked really hard, and I am so proud of that background. I owed it to the ancestors who came before me, and I want you to embrace whatever your distance traveled is. Talk about it, embrace it, brag about it. It is what makes you a good human being. All right, find your 4-year pre-health advisor early for those of you who have to transfer from us and you need to go to a 4-year school to finish that undergrad degree. You need to find that pre-health advisor early. Walk on campus, politely introduce yourself, get to know them. They're going to write a letter for you, and unfortunately, they're only going to have 2 or 3 years to get to know you instead of the 4 years that your competition had. So if you are about to transfer somewhere, please let us know. We'll help you find that pre-health advisor and that office and help make the introduction for you. Consider a gap year. This is especially true if you miss an application deadline, or maybe you know, my grades have been great. I took that PCAT for farm school. I did pretty well. I've got no experience though. So maybe today's the day where you go, let me call up continuing education and workforce development at PGCC. Let me find out when their next pharmacy technician class is. Let me take it. Let me pass my cert test. Let me go into the workforce. Let me work for a year as a farm tech. And then you will have had a gap year where you earned a paycheck and you improved your application. Keep your grades up at all times. It is not about the A. It is not about getting an A. It is about earning the A or the B. Be flexible. If something doesn't quite work out, you might have to change your plan. I think that engineering is super cool. The fact that people can design a building and it doesn't fall down blows my mind. But the good Lord did not put me here to be an engineer. I can't get past Calc 3. Okay, so I'm not meant to be an engineer. So sometimes we're just not in our thing yet, right? Um, Everybody was put here for a reason. The hard part is figuring out your reason. Your reason might not be nurse, but you might find out along the way that your reason was radiography instead. Those letters are important. Remember, form relationships, keep those relationships going, foster them like a friendship. And here's the last one, get experience now. Again, certified nurse assistant, geriatric nurse assistant, EMT, pharmacy technician, phlebotomy, medical scribe. If you're interested in the world of veterinary medicine, veterinary technician or vet assistant, okay? So these are all entry level, but excellent opportunities. Most of these we do have available at Prince George's Community College. Be happy to put you in contact with, again, our workforce development, continuing education folks. They'll take great care of you. They will make sure that you start on that pathway to get to your goal. And when you get that entry level position, then you're going to continue to work with advisors and faculty like me and Mr. Assanah or Mr. Van Cleef, and we're going to make sure that you get to that end goal. You just got to come and meet us. So I took up 35 minutes of your time. I know it was a long one. The video is available for you to review at any point in time. Feel free to contact me, Mr. Assanah. Dr. Stansbury is the Associate Dean of our STEM division. He knows all the right people, and just tell him, I want to be A, and he'll find the person for you to talk to. Mr. Van Cleef is our advisor for our division. He's extraordinary and awesome and helpful, and we're all here. You just need to come and say hi. Take care of yourselves. Know that we want you to be the best, fill in the blank, and our job is to help you get there. Be well, take care of each other, be compassionate, and we'll talk to you soon.